Good morning. Welcome to Wellness Wednesday. Thank you for joining us this morning. Our Wellness Wednesdays air second Wednesdays of each month, bringing focus to a different mental health topic each time. My name is Nicole Moccasin. I am the community health worker for the Ponca Tribe of Nebraska in Lincoln. Joining me today is Dr. LuAnne Even, Chief Behavioral Health Officer and Clinical Psychologist at the Fred Leroy Center. Thank you for joining us today. Okay, so today we're going to be talking about suicide awareness. So with September being a suicidal awareness month, could you talk a little more about the impact of suicide?
Absolutely. So suicide is an extremely impactful mental health problem. In the United States alone, it's the 10th leading cause of death. Suicide kills about 800,000 people per year, and that equates to about one person every 40 seconds who dies by suicide. And for every single suicide, there's at least 25 attempts, and that's considered to be probably underreported, just based on the fact that a lot of those attempts and suicide deaths don't get reported.
Why do people take their own lives?
I think that's a really good question. I think something that people ask a lot, and a lot of times people think it's one cause, like I was being bullied or I went through a divorce, and that's what leads somebody to die by suicide or to take their own life. But really, it's not any single cause or any one reason, but rather multiple intersecting factors. So there's health factors, which can include both physical and mental health. So something like a chronic condition like pain or cancer, but also mental health diagnoses such as bipolar, depression, or anxiety. There's also historical factors, which can include family history of suicide, death, trauma, any kind of family history of depression or bipolar disorder, as well as environmental factors. So this could be access to means such as guns or lethal weapons. It could also be prolonged stress or any kind of an adverse event. So any of those things kind of play together to create the kind of catalyst for somebody to lose their life by suicide.
In addition to the risks of suicide you just discussed, is there anything that can reduce the likelihood of someone will die by suicide?
Absolutely. So like I just described those risk factors, there's also something that we call protective factors. So when somebody is involved in mental health care, maybe they're seeing a psychiatrist or a therapist, if they have strong family and community support systems, if they have strong problem solving skills or good or what we call kind of resiliency, and also any kind of cultural and religious beliefs, those are all things that we call protective factors in that they can reduce that risk of suicide.
Okay. Suicide is a difficult topic with a lot of stigma surrounding it. What can we do for someone we may be worried about?
So I think that's the most important part of our conversation today. So first of all, you're going to want to watch for warning signs. And these fall into three large kind of categories of changes in talk, changes in behavior, and changes in mood. So changes in talk might look like someone saying, I don't want to be here anymore, or I'm thinking of killing myself, or I just can't do this anymore. It can be very direct or even passive. So those are warning signs of talk. Warning signs of behavior look like somebody becoming kind of reckless and using drugs or alcohol, or maybe they are sleeping a lot more, and maybe they are starting to give away their possessions. So any kind of changes in their behavior is considered a warning sign, and then also any kind of change in mood. So somebody becomes really depressed, or maybe they become really angry and they're just lashing out, or maybe they're crying all the time. If you notice any change in mood, you'll also want to reach out. So that kind of brings me to the next point. If you notice that these warning signs are going on, you want to reach out to that person. Maybe pull them aside, make sure you're talking to them in private. Listen to their story and express concern for them. It's really important to ask directly about suicide thoughts. I know a lot of people are worried that if they ask about suicide, that maybe that'll put the idea in their head, and that's just not true. In fact, asking about suicide is not going to put that idea there. If someone's not thinking about it, you can't make them thinking about it. But what that does do is open a conversation for that person. And then you want to encourage them to seek help. What you don't want to do is diminish their thoughts or feelings. You don't want to, try to convince them that their life is worth living, and avoid giving them advice. Really just listen to them and encourage them to seek help. And then if If you don't feel like they're safe, you want to stay with them. Remove any access to means, whether it be guns or knives or pills, and then escort them to services if possible.
Are there any support groups you can refer family or a person feeling suicidal to during this time?
Absolutely. So if someone is feeling suicidal, they're very depressed, encourage them to seek a counselor. So here at Ponca, you could reach out to our behavioral health department and get set up with services that way. Another really great resource is the National Crisis Line, and that number is 1-800-273-8255. And that's a 24-hour crisis line where you can talk to somebody.
Oh. Well, thank you, Dr. Even. Any other tips?
I think it's just important to remember that talk can save lives. So make sure you're reaching out and having that conversation. Don't be afraid to talk to them about how they're feeling.
Well, thank you, Dr. Even, for joining us today, and thank you for watching us here on Facebook. Join us for our next Wellness Wednesday on October 13th.